Hey y'all, it's me back with another video. So I just wanted to come in and let you guys know that I am doing much better. Um, so far so good. The surgery was probably about 30 minutes, maybe. If that. It was really quick. So what I had was called a trigger release surgery. So I had what is called trigger finger, and that is where the tendon in your finger, and it could be any finger. It don't have to be the thumb. Mine was in the thumb. They actually said that ring finger is the one that triggers the most, but I had it in the thumb. So what it does is is the tendon locks, and what they do is they go in and they put like a little incision in the tendon to release it so it doesn't do this locking thing. So mine also had a nodule on there, and I think when they released the tendon they cut the nodule. I don't think they removed the nodule because it's attached to the tendon, I think is how he explained it. I don't know, I could be saying it wrong. But they don't remove the nodule. They do something to it. So the surgery is you walk into the it's outpatient. You actually wash your hands before you go into the surgery room. Outside the surgery room, you wash your hands just like the doctors do. And then you go into the surgery room, they lay you down on the table, and then they clean your hands again with the sterile solution that they use, and put a tourniquet on to help with the bleeding. And then a doctor comes in, and that's when they put up this big drape, so you can't see what the doctor is doing because you're woke during the procedure. They don't put you to sleep. They give you a shot and numb your hand up, and then they operate. So the doctor comes in, he's talking, and I guess he like pinched or stuck me or something to make sure that I couldn't feel anything. I couldn't feel anything. And he's doing the surgery. And of course, there is the nurse there with him, handing him the tools, and him and the nurse are talking. And he's like, okay, this is the blah, blah, blah nerve, this is the tendon. And, it's like weird when you know that you're cut open and the doctor is looking inside your body and talking about what they're seeing, and you can hear everything. Like, I could feel him like moving my hand and stuff, but of course you don't feel any pain. And when he did the stitches, I could kind of feel him pulling the whatever string they use for the stitches. Like, I could feel it, him tightening, and I could hear the scissors cutting and everything. I mean, it's such a crazy feeling to be woke during surgery. That's the not fun part. And I think, my brain was like, they cutting on you, and at one point, like, I started shaking. I couldn't like stop myself from shaking, and they were like, "Are you okay?" I was like, "Yeah, I guess I do have anxiety." And they were like, everything is fine. Everything is fine. He's almost finished. And the nurse was talking to me and stuff, and um, trying to calm me down. So after the doctor got finished, he was like, I'm finished now. You did great. It's everything is over. And he was, going over some of the um, things to do when I got home and everything. And then they sat me up and they made me sit there for a while because they said, sometimes after surgery you can be dizzy. But I wasn't. I was fine. After everything was over, I got up and they take you to the recovery room and then they give you your discharge papers and you come home. So, the only thing I have been having a little bit of pain, not like severe pain, like the day after when the numbness had wore off and everything, I was in some pretty severe pain. And my finger, it seemed like it had swole up. My thumb was swollen, but that's normal. I put an ice pack on it. The only thing I've been having is a lot of itching, like my hand and arm has been itching. I've been itching more than I really been in pain. So the thing too is for the first 3 days after surgery, they want you to keep your hand elevated above your heart because that also keeps down this is the hand. You can see it's still bandaged. And it'll be bandaged for 3 more days. Then I get to take the bandage off and just put a regular band-aid on there. So right now I can't get it wet at all. So you got to put a plastic bag over your hand to take a shower. Just, be real careful not to get it wet. So that's it, y'all. Um, right before I was going into surgery, it was a young lady coming out of surgery waiting to get her discharge papers done, and she had had the carpal tunnel surgery. So my surgeon, he does a lot of um, hand. Well, he's an orthopedic surgeon, so you know he does a lot of surgeries. So I go back, I think, on the 20th to get my stitches removed, and that's that. So I'm gonna show y'all what it looked like when I take the bandages off in 3 days. So I've just been resting. Anytime you have surgery or anything like that, the best thing for you to do is, give your body a chance to rest. So I just been relaxing and making sure I'm drinking enough water because I am taking some pain pills right now. So I'm making sure I drink enough water because pain pills have a tendency to constipate me really bad. But that is it. And hopefully I'll see you guys soon. I know I look a hot mess because I did not braid my hair before the surgery and my hair is just on top of my head. But I'm just going to deal with it until I can do better. So I will talk to you guys later. I love you. Bye.